Okay, so let me just go straight to the eye health Luaxanthin. Everybody could see this?
Yes.
Okay, good. Okay, so we got a new product. Yes, the product name is Eye Health Luaxanthin. But me as a Korean, it's hard to pronunciation, like a really thin pronunciation. So I'm gonna just say Luaxanthin. Okay. Even Korean says Luaxanthin. Okay, so this little bottle, but has about 3 months supplies and $45, which is not too bad because 1 month supply means like $15, right? And then 28,000 PV. Okay, so just launched, I believe yesterday, right? Okay, I'm very excited about this because my mom actually took this product in Korea. This product came, I think, about a year now in Korea. So when I was in Korea last year, I bought one for my mom because my mom had it wasn't the surgery, but she has some issue with her eyes. All of a sudden, her vision got just totally blurry. So she was taking some injection for her eye directly. It's really tough kind of situation my mom went through. So so that's why I ordered one bottle for her, and she said it really helped her a lot. So that's why I knew this is really good, and then I was expecting coming to United States, and then finally it came. Okay. um there's four things kind of main keys here. Complex specifically formulated to support eye health. So basically this is the main ingredients: lutein, zeaxanthin, astaxanthin, and zinc, and vitamin A. These all ingredients I will explain one by one, and then also 6 additional ingredients. So even though this how do I say, this is something not main ingredients, but then all 6 of ingredients really help for the eye health. Okay, and plant based soft gels and small soft gels, so easy to swallow, very tiny. Okay, but even though it's a tiny, but it has everything in it. So 90 soft gels, which is 3 months supplies, and take just one soft gel daily. Okay. This I think I'm gonna ask my mom about when they should take, but my mom usually take all the medicines like in the morning. So but then if it doesn't really say when do you need to take. So if you have already many kind of medications or other like health supplements taking, then you could just kind of divide it and then right amount. It's not too much in the morning, or not too much in the evening, So you figure, if you add just one small soft gel when it's better, so you figure out, okay? Okay, so main ingredients here: the lutein, zeaxanthin, and astaxanthin. Okay, so lutein, we already have eye lutein. That's so basically, if you know about what lutein does, then that product is for that. Okay, but then we added more ingredients for the promote the eye health. Okay, so lutein mainly distributed in the periphery of the macula. Macula is the I will explain the macula later on, but then what it is, it's the behind the eyeball. Is there any like a medical term for eyeball? I'm gonna just say eyeball, okay? The behind the eyeball, there's the um um little spot that kind of little it went in. Okay, it's not outer, it's just inside, just a little bit, very tiny bit that went in, and that part's actually kind of collect the like a lighting, and then or the also detect the shape and the colors and stuff like that. That's the macula. Very important roles macula has. Okay, and so and then zeaxanthin is mainly distributed at the center of the macula. Okay, and astaxanthin helps relieve eye strain, which is like when your eyes are really tired. Okay, then and also you will have like dry eyes, and sometimes like I feel like a heat on my eyeball when it's very tired, because something I couldn't sleep well, or I got something to do like in the middle of the night, so I couldn't sleep like good enough. Then my eyes like feel like a heat sensation or tired. So astaxanthin is for that. Okay, for tired eyes. Okay, so now, so quadruple function complex. So it's everything's here. Lutein, zeaxanthin, actually they made like a combined complex extract. So that's a one function complex. And then this is astaxanthin, hematococcus extract. That's actually astaxanthin, and that helps relieve eye strain. I already explained about this here. And then another main ingredient is zinc and vitamin A. So I'm gonna explain about the zinc. Zinc, everybody knows that zinc is for the boosting immunity. Okay, immune system. It's the same as like eyes. We also need a immune system, so that way we don't get like easy to get germs or bacteria, and some people really get get pink eye all the time. That's also like immunity is kind of low. That's why immune. So zinc helps that immunity boosting, and then also necessary for normal cell division. So we need zinc. Okay. Now vitamin A. Vitamin A helps adapt vision in darkness. There's some disease name I forgot. Like at nighttime you have like a really poor vision. So those people who has a poor vision at night, they're not to drive. Okay, one of my friends, she's in early 40s, but then she has that problem. So I'm going to recommend this product to her. That's why she's really scared about driving at nighttime, because she gets like poor vision at night. So vitamin A is for that. Okay, and then also forms skin and mucous membranes, and also you need a mucous membranes to protect all the dust, all the bad from bad things from the outside, right? And also necessary for growth and develop of epithelial cells. This is also like something vitamin A helps that our eyes has a lot of different types of cells. So vitamin A helps that growth and development of epithelial cells. Okay. Now 60 ingredients. I'm actually familiar with all these 6 things, because not this one, but then all these are like seeds and herbs and fruits and everything's our Korean people eats all the time. So but basically what these 6 ingredients does, basically just helps your vision, promotes the vision, and also antioxidant, as you see, like berry mix, and then orange tree. So antioxidant, everybody knows that antioxidant does that, prevent the aging, right? And also prevent the also like getting disease or getting sick, right? So 6 ingredients does that promote eye health. And also hyaluronic acid. Everybody knows hyaluronic acid because high, as you see the picture, hyaluronic is basically something hydration, related to hydration. So our skincare products has a hyaluronic acid because that gives you like moisturize and all that hydration, right? So this helps that you probably noticed that this helps our dry eyes. When evening time, all day you use your eye to look at the computers and look at the phone and TV and whatever. Your eyes are open until like you go to bed, right? So your eyes really worked all day. So now like you get like a very dried eyes, right? So hyaluronic acid for that dry eyes. Okay, and our soft gels made out of tapioca. What's tapioca is? I don't know. You guys know about the bubble tea or boba tea. We Asians loves boba tea or bubble tea, especially my daughter. She's just crazy about bubble tea. All those like a kind of black bees, kind of chewy things on the drinks. So we made out of the the soft gel from tapioca, and this is basically I would say just kind of starch. Basically, it's just starch. Okay, so when it goes to our body, it just dissolves right away. I think that's why they use the tapioca. Okay, now eye strain. Eye strain is basically like a tiring eyes. Okay, so when we use our eyes vision, like if you look at further, then actually the muscles are really relaxed. Okay, but then when we look close, like let's say iPhone, we look really close, right? And also like computer, just right now you guys are really look at the computers probably really close. So your eyes get tired. So eye strain, and when your eyes are tired, the muscles holding your eyeballs are also very tight and then very contract. Muscles are contract. So so you need to really relax your muscles around the eyes, holding the eyeballs. Okay, so and also this is basically same thing I already explained. Like we don't really see it, we don't really feel it, but then there is a blue light from the or the devices, like electronic devices. So that actually really harm to our vision, and eyeball, like make really tired fast. Okay, so this is what it does, and our product Luaxanthin is gonna help all that like a tired eyes. And the macula, I explained earlier, the macula. Okay, this is iris, and then cornea and lens. Lens are here. Okay, so actually behind, not exactly the behind, but then somewhere in the somewhere behind the eyeball, it's somewhere there, and the shape wise, it's not like outer, it's actually kind of it went inside. Okay, it went inside. So very tiny bit. It's not big, but then it's tiny bit. But then what it does, it's an oval shaped area in the center of the retina of the human eye, and plays an important role in visual acuity. So basically, it detects the object, detect the lighting and also color and the object recognition. So very important, important roles plays. So if you look at how do I say, the mechanism about the camera. So when the lens, take the there's the object in front, and then when you click the shutter, whatever, then it just the object going back to the big camera, right? I'm talking about the old, like a vintage old camera, not the digital thing. I mean, pretty much the same mechanic, but then maybe it's easier to kind of imagine that thing. So that object coming to that some spot where it really grab the object and recognize the object. That's what is the macula. So and also high density of conical cells involved in light, color, and shape detection. So it's conical, so it's like a kind of looks like a cone. Okay, the cell shape is like a cone. And also macula. I kind of also kind of research a little bit about the macula, and then macula, around the macula has a lot of cells, very important cells there. Okay, so the cells has to be maintained certain numbers of cells, but then as we aging, the cells actually kind of decrease, the number of cells are decreasing too. So cause of macular degeneration, abnormal vascular production in retina due to capillary disorders. And also, I don't think you guys are smoke, but then smoking also cause that problem. And then high fat, high calorie diets, stress, obesity, and hypertension, and family history. So basically, like if you so sometimes like keto diet is not really good. I don't really like suggest a one food diet. Okay, you have to eat all the nutrition from the food that like a right ratio fat, carb and protein. But then these days, like a keto diet, like a so focused on only fat and protein, right? No carbs. But then I don't really suggest, even though you probably see the result like a losing weight right away, because I've seen some friends that had I mean the results like I was amazed, like about 6 or 7 months tried a keto diet, and then he lost so much weight. I was surprised. But that, I don't know, I mean, for the long run, I don't think that's really healthy diet. But anyway, so this could high fat, high calorie diet, those are also cause that problem, right? And this is the by age, look at in each 10-year age group. So 20s, 30s, of course, they're young. Okay, but now like 40s and 50s and 60s, look at this graph. It's just like decreasing like crazy, right? Like muscular pigment density. We need to keep the pigment density or the high, but then as we aging, the pigment density is decreasing. Okay, so it really low when we are like a 50s and 60s. Okay, so now hematococcus, which is astaxanthin. So this is like a 4 weeks intake of 6 milligram per day for 4 weeks. They I think this is like a experimental group. So the right side eye and the left side eye. So as you see, after taking 4 weeks, the blood flow got better, like an increase. So and also whatchamacallit, yeah. So this luaxanthin basically helps also like a blood flowing. Okay, so causes of deteriorated eye function. Physical factors are basically like by aging, when we are older, then all that functions like getting like less and less, right? or especially muscle area, eyeball holding the muscle. Those muscle really function not well. But then environmental factor, which is we could improve this, at least we could prevent, heavy use of digital devices. Man, this is hard, right? Every day we are holding phone almost like a 20, like almost 24 hours, okay, besides a bedtime. So heavy use of digital devices and stress, nutrition, poor eating habits, and smoking and extra. So at least we could, try not to do this, right? And also the doctor, one of the doctor mentioned that try to look further. If you guys have like the park around your house, or some, or if you could even just find some good place that in like a really wide open space, then you could just look at the further, and green color is really helps. I guess Karen, you're really good. You're in the good place to see all the greens all the time. She likes gardening and so plants. So yeah, so look further. So you have to relax your eye, the muscles around the eyes. So okay, so that's it.